terbium is a very cool molecule because it has a very similar kind of a decay protocol as compared to lutetium. It's very similar to lutetium. It has a similar kind of a half-life. So the half-life of lutetium is about 6.6 days. The half-life of this is about 6.8 days. It has similar energies. So the beta energies are very similar. The advantage of terbium is that along with the beta decay, it also emits certain particles called Auger electrons or conversion electrons. Now these Auger electrons or conversion electrons are small, very energetic electrons, which they have a very low penetration in tissue. So they are very energetic, but they manage to kill cells only in the local vicinity. Now, what happens is that often when you have a tumor, there are single cancer cells which are residual on the surface of the cells. And these cells often escape the more penetrating beta rays which come out of lutetium. And then these cells are responsible for increased recurrences. Now, what these Auger electrons do is that they manage to target these single cancer cells which are sitting on the surface of the tumor. So the hypothesis is that the recurrence rates when we use terbium would be lower than when you use lutetium. With terbium, the other advantage is that you're able to deliver almost 40% more radiation per unit of radioisotope which is injected into the patient. So which basically means that as compared to lutetium, you can give almost 30 to 40% less of radioisotope and deliver the same amount of radiation to the tumor. Now, this becomes a huge advantage because with every unit of radioisotope, there is certain amount of toxicity which is there. Now, that toxicity may or may not manifest as clinically evident toxicity, but it is there. So there is a risk of having long-term renal toxicity. There is a risk of having long-term bone marrow toxicity. With terbium, with almost 40% less of radioisotope as compared to lutetium, you can deliver the same amount of radiation to the tumor. Taking it a step forward, with the same amount of terbium as lutetium, you can deliver 40% more radiation to the tumor. So it can work both ways. We know that the response of tumors is more when you are able to deliver a higher and more concentrated form of radiation. And we have seen this when we have used alpha emitters, right? So with alpha emitters, because they are more energetic particles, they deliver almost, 75, 100 times more radiation as compared to the beta emitters. We know that the cell kill is higher. So terbium is somewhere in the middle. So it gives us more radiation as compared to lutetium without having the toxicity which is associated with the alpha emitters. So probably terbium can be a kind of a bridge between the beta and the alpha emitters. We still don't know. We still don't have enough evidence to suggest that. But these are the potential hypotheses with terbium. The beauty of terbium is also that just like lutetium, it is a radioisotope which can be labeled with the same ligands or the same vectors as lutetium. So you can label it with PSMA, you can label it with dotatate, you can label it with FAPI. So you can have all the entire advantages of lutetium therapy, whether it is in prostate cancer, whether it is in neuroendocrine tumors, whether it is in certain other tumors where other agents like FAPI are used, with an enhanced